Okay. One of the things I want to talk a little bit about in this mini lesson is the typical structure of a diarthrotic joint. In this case, we're going to look at the knee. And there's a couple diagrams in your book that are helpful in understanding this particular structure. These are all located in Chapter 7. So if you have that on your tablet, you can go ahead and go to that. But the basic idea is all diarthrotic joints are similarly structured. They are different as far as names and anatomy, but the basic details are very similar. So page 168 shows kind of a couple different views of a knee. And we're going to kind of go through each of these main structures. You will need to know this for the test next week, which at this point will be Monday. Okay, so let's take a look at this particular structure. The first thing that you will notice in a diarthrotic joint is a capsule. This is called an articular capsule, made of dense connective tissue. And one of the jobs of this capsule is it's first of all protective, but it also secretes a fluid to help to lubricate the joint. Okay, so this is actually a fluid-filled sac. I kind of think of it like a Ziploc bag that surrounds every diarthrotic joint that you have, whether it's the little interphalangeal joints in your fingers all the way down to your knee and ankle and shoulders, okay, some of the larger joints of the body. Within this capsule, there's articular cartilage, which we've talked about. This is what covers the ends of bones. This is made out of hyaline. Hyaline cartilage, it's not as hard as bone, but it is a little bit more forgiving than bone and won't be as brittle. On a knee, specifically, we call this the meniscus. So when we talk about articular cartilage, only at the knee, we call it the meniscus. And there's a medial meniscus toward the middle and the lateral meniscus toward the outside. And if someone's got a torn cartilage or torn menisci, then that's what has been ruptured or been torn. Okay. A third component that all diarthrotic joints have, especially the knee, are things called bursa. Bursa are fluid-filled sacs to help reduce friction between structures. Usually it's kind of like a Dr. Sol's gel pack. But these are fluid-filled sacs located between the skin and muscles, or even muscles and bone. Any place where there might be some friction, these reduce that friction, so it's more fluid of a motion, of a movement. There can be a condition where these sacs burst. If I could spell it right, called bursitis. Bursa are called bursitis, and there's a lot more friction involved, and so there can be a lot of pain with increased mobility. The main thing about your knee that we need to understand is ligaments. Ligaments are what hold bone to bone. So these are going to be dense connective tissue, similar to a tendon, but tendons connect muscle to bone. These connect bone to bone. And the whole purpose is they help to stabilize your joint by resisting stretching. You don't want ligaments to really stretch. So there is a model up here in front of you that shows a knee. Billy can grab it, or somebody else can grab it if you're watching this in class. If you're watching this at home, then you have to use this model. What we see here, this is a bent right knee. Okay, first of all, I can tell it's the right knee because as you're looking at it, this is the tibia, which is always medial, and this is the fibula, which is always lateral. Okay, so this is a right knee. The patella's been removed. The patella would have sat right in through here in what looks like a little notch. But we're going to ignore the patella because it's gone. And the femur has been flexed. Okay, so imagine your knee flexed, and that's basically what you're looking at, the end of the femur. Let's point out some of these ligaments. You need to memorize these four. Okay, patellar is actually a tendon. All right, 4. Tibial collateral, or sometimes called the medial collateral ligament, sometimes just abbreviated MCL, like the cafeteria store. The tibial collateral is connecting your tibia to the femur. Okay, I'll kind of outline it here. And that's going to resist motion that would cause that to stretch. Okay, so it's going to resist the femur going this way or the tibia moving this way because that would cause that to stretch. Okay. The other collateral, the fibular collateral or your lateral collateral, either one, sometimes called the LCL. Your lateral collateral connects your fibula to your femur, so it's this one. And it's going to resist motion of the femur that way, or it's going to resist motion of the lower leg that way. Okay, it's resisting those motions. So between the two collaterals, it's resisting motion side to side, rock. Okay, imagine rocking your knee back and forth, top and bottom. Okay, and that's what's going to resist that motion. The other two, let me erase these. The other two, the posterior cruciate and the anterior cruciate. Posterior cruciate is going to connect, the back of the tibia. It's kind of hard to see it. I'll outline it here. The back of the tibia to the front of the femur. Okay, that would stretch down. You can't see it, but it would stretch down like that. The back of the tibia to the front of the femur. And then the other, your ACL, is connecting the front of your tibia to the back of the femur. Your ACL. Okay? Now again, this is looking from the front of your knee. So ACL is going to resist motion of the top going back or the front moving out. Okay, it's resisting your lower leg going out farther front. The PCL is resisting the opposite motion. Okay? So one is resisting one of the bones going forward and one is resisting the other bone moving backward. Okay? So between the two of them, it's resisting this front and back motion. The collaterals are resisting side to side motion. And so this is a stable knee. If you've got those four ligaments, your knee should stay in the correct alignment. Your patellar tendon, it's not shown here, okay, but here's your big quadriceps muscle. Here's your patella right in the middle that slides, and you've got a tendon that connects to that, and that anchors itself down here on your tibia. The patellar tendon is right there. It's going from the patella down to your tibia. Okay, but it actually grows from your large quadriceps muscle, which is up there. Okay. Two words that are easily confused: sprains and strains. Sprains are the result of ligaments being stretched beyond what they're supposed to. It's like taking a rubber band and stretching it too far. But there's no usual dislocated bones, and some severe sprains can actually be worse than broken bones. Strains have to do with muscles. Okay, you've overworked a muscle, it may have had a cramp or something, and you've strained your back or you've strained your hamstring. Okay, but it's always in reference to a muscle. Sprains are in reference to ligaments. And if we had time, I would show you an ACL reconstruction video, but if you want to do that on your own, that's fine. Okay, that's all you need to do for this.